Balding, something all men fear, and unfortunately most men experience. Around 70% of men will lose their hair eventually, although there are ways to prevent or slow down the onset of male pattern baldness, and in some cases even reverse it. In this video, I'll briefly summarize all methods and theories on how to combat male pattern baldness. But first I'll quickly go over the causes of balding. Balding is caused by the shrinkage and eventual disappearance of hair follicles. What causes this is still under some debate. The most persuasive theories are that it is caused by a restriction of nutrient access to the follicles, followed by an accumulation of DHT, a form of testosterone that is used by the body to create scar tissue. There are also external ailments that can cause baldness, such as cancer, arthritis, depression, gout, high blood pressure, and excessive stress and anxiety. Okay, on to the solutions. First, pills and supplements. Most hair loss curing supplements have little evidence for their effectiveness. However, hair loss can be caused by a deficiency in certain vitamins and minerals, such as vitamin D or omega-3 fatty acids, so taking such supplements could be beneficial to your overall hair health. However, it won't cure your baldness. More potent oral medicines, such as minoxidil or finasteride, have been shown to reduce hair loss. However, the ingestible versions of these medicines do come with negative side effects. The second method to reduce hair loss is laser therapy. Laser therapy, or red light therapy, has been shown by some studies to reduce hereditary hair loss and improve hair density. The theory is that the red light penetrates your skin and agitates your cells, improving circulation and blood flow, thus improving nutrient access to your hair follicles. There is evidence to support this theory. However, more research is required to conclusively prove its effectiveness. My advice is to do laser therapy in addition to other routines to maximize the probability of success. The third method derives from a theory first popularized by Rob English. In a nutshell, the theory is that alopecia is caused by the gradual tightening of the scalp as men age. The stress caused by the ensuing loss of circulation leads to the shrinkage and eventual disappearance of hair follicles. Then DHT, which is correlated to hair loss, causes the affected area to scar, thus preventing hair regrowth. The proposed solution to this is quite simple. Stretch the scalp and maintain high levels of circulation. The first way to do this is by getting Botox injections in the surrounding muscles of the scalp. Botox acts as a muscle relaxer, thus loosening the scalp. There have been a few studies into this. The results are positive overall, with both studies showing that there's been a 75% positive response rate. However, the conducted studies have been quite limited in scale. The second way to loosen the scalp is by physical stretches. There is a method to do this published on Perfect Hair Health. I'll link it in the description. This method is preferable if one wishes to avoid using intrusive medical procedures, such as Botox injections. However, it has less scientific support and is likely to be less effective, as well as coming with a substantial time investment. The fourth method is topical minoxidil. Topical minoxidil has been proven to reduce hair loss and even regrow hair. It does this by instigating hair follicles into the growth phase. This will thicken your hair over time and prevent the overall loss of hair density to a certain extent. However, it must be noted that minoxidil causes an increased rate of hair shedding, as the follicles are forced into the growth phase, and you must commit to religious use of minoxidil twice a day for many months to see results. If you stop prematurely, it may actually have negative consequences to your hair health. The fifth method is microneedling. Microneedling is a method of improving blood flow to the scalp. This is achieved by inflicting a small amount of damage to the surface of your skin by penetrating the surface with needles. This causes the body to direct blood flow and nutrients to the afflicted area. Supposedly, this will help the hair follicles. Microneedling has been shown to enhance the effectiveness of topical solutions, such as minoxidil, as well as improving blood flow. However, it is quite uncomfortable to perform microneedling. It must also be noted, the microneedling comes with the risk of infection. There have been cases of terrible fungal or bacterial infections caused by microneedling. Therefore, if you choose to engage in microneedling, you must be sure to properly sanitize all equipment before use and take all steps to reduce the risk of infection. There are other less substantiated methods of reducing hair loss or regrowing hair. I'll briefly list them. Topical oils such as peppermint or lavender oil have some support, but lack any substantial proof of their effectiveness. Using ice to improve blood flow. The theory suggests that by icing the scalp, the body will react by improving blood flow to the region. It is true that icing an area improves blood flow, but the duration and substance of this effect is under question. Herbal supplements. I'd advise to not take these very seriously when it comes to hair loss. Focus on maintaining a healthy diet and supplement program. Links to all methods will be in the description of the video. My advice would be to, first, make sure you have no vitamin deficiencies and are in good health. Next, try a combination of the less invasive methods, such as scalp stretching in combination with laser therapy and a good exercise routine. Also, do what you can to reduce stress. If this fails, then if you are adamant about keeping your hair, try some of the more extreme methods. And if all else fails, a hair transplant is always an option. Thank you for watching. If you feel generous, please leave a like on the video. And if I missed anything, please let me know in the comments section.